Good morning, everybody. Welcome to Dental Voice. My name is Rolando Mia, and I work with Zyris. Today, we have a special guest, somebody who knows so much about dentistry, who has an immense amount of experience, and I'm really excited to hear her insights into what's going on with regard to this whole COVID crisis, as well as advice for us with regard to how to get through this. I'd like to introduce you to Dr. Anne Marie Silvestri.
Good
Dr.
morning.
Anne Marie was the former dental manager for the County Hospital San Mateo. She's also an adjunct professor at UCSF and UOP, had her own practice, and has been practicing dentistry for 40 plus years. So I'm really excited. Thank you for joining us, Dr. Anne Marie. How are you doing?
Thank you, Rolando. I'm doing fine. I've now entered a new stage of retirement and COVID virus time.
I believe the COVID was waiting for you to retire because it was fearful to come in before you came in. Is that a true?
Oh, that would be interesting to think. If that were the case, I should have stayed there longer and gotten it out of there.
So you've been in dentistry and you've experienced oh my goodness, over the last 40 plus years or so, probably so many different events that have affected dentistry. When you look at the COVID-19 pandemic and the crisis we're in, this is the first time I believe that it has been absolutely far-reaching. What impact, or from your perspective, what what are your thoughts on that, and what insights do you have about dealing with this right now?
So this is, like you say, I've been doing this for quite some time. When I first started to practice in 1975, dentists did not use masks or gloves or anything. And then the AIDS epidemic hit, and it changed the way we did infection control. And I think this will be another change, an upscaling of how we do infection control. When I hear of what they're asking the medical to do, it's what we've been doing in dentistry for lots of years. Your dentist wears a glove, wears gloves, your dentist wears eye protection, your dentist wears a mask. And now they're upscaling it to wearing a shield in addition. And at the medical center, we've actually been wearing shields for several years. So when I heard of what they're asking for infection control, I literally said, go watch what we do in dental.
So if you look at it, it's not anything truly new in dental. It's a protocol that's already been in place. Is that correct? Is that what I understand?
Very, very much so. I think that the idea of wearing the shield is new to lots of dental offices, but we've done it for years.
Wow. So over the many years that you've been working, you've seen a lot of things come and go. From your perspective, what would you say is the key advice that you want to give people to kind of think about that, the issue, and then overcome it, or navigate through it? What advice would you give people regarding that?
Two ways. For providers, I would say to be careful for yourself and your staff and your patients. For patients, I would say, look at your dentist. I'm sure that he or she is wearing a mask, and that's to protect both of you. Eye protection. The eye protection really protects the dentist from splatter that can go into his or her eyes. Shields go over the eye protection as more of a protection. You know, I was talking to someone, they said they remembered going to their dentist and they saw splatter going all over the dentist's face in the old days. Yuck. And so give us a shield, protect yourself. So both need to protect themselves. I would personally think that any patient that goes into a dental office with the universal precautions, as we call them, would be safe.
Wow, thank you for that. I love
Well,
the reminder that, one, this has been in place for a while, and then two, it's protections for both sides. We're hearing so many comments, and we're hearing this anxiety around the uncertainty of what's going on. There seems to be so much information. We haven't received clear guidance from the CDC, from the ADA, from the state or organizations. How should people, or from your perspective, how should you disseminate, and that what information should you be listening to?
All of it, I would say, because we really don't know. If you look back to the early 80s when the AIDS epidemic was here,
Right.
nobody knew what they were doing, right? We started to take precautions because that's what we thought we had to do. So, again, this is another step up, but we need to learn from that experience that it can be overcome. When you go to a dentist today, they don't care whether you are HIV positive or not. Everyone's treated with what we call universal precautions. And I see this as the future as we go forward.
Wow. Okay, it's amazing. You just are calm. There's a confidence that makes me feel like, holy cow, this is going to be okay. And I love it. I appreciate you bringing that because, there's a lot of stress. People are having so much anxiety about the uncertainty of what's going on. How can you be so calm?
Well, the thing is that in the early 80s, when I was in San Francisco and there was a huge AIDS epidemic, one of my biggest referrers was one of the doctors that was in the front line of discovering AIDS and Kaposi sarcoma. So, along with him, I had to be comfortable in treating patients that were, quote, infected. So, we had to find a way, we had to protect ourselves, and we had to protect other patients from getting this. I think that if you're too fearful, you're not going to be observant of what you need to do. I personally think that anyone who goes to a dentist who has been following universal precautions will be okay. Today, we're only treating emergent cases. We're treating cases that have less splatter value because that's where we're finding transmission through the droplets. It's said that this virus can stay alive on countertops for a long period of time. But see, in dental, we've always used the proper infection control mechanisms and wipes to clear off the counters, to clean the chair, to wait in between, to run the hand pieces to make sure they're clear. We've done that. This is what we've been doing. I don't think there's going to be a big step up in what we do in infection control in dental if you've been following universal precautions. The mask, the not the mask, I'm sorry, the shield might be new to a lot of offices. You go in kind of looking like you're ready to step off on the moon, right?
It's awesome. Thank you for that. Now, you mentioned the whole precaution. The one thing that seems to be coming up, and this is prevalent, and I'd love to get your perspective on it. Up until this point, infection control, there's been a protocol around infection control. However, what we're hearing from other clinicians, from people in industry, is that the issue of aerosols has been a something that's kind of people are aware of or people are knowledgeable about, but it's not as prevalent as the spatter. The splatter spray is, you can see that, but then what we're seeing is aerosols less than, I forget, 20, somewhere in the 20 micron range, can actually float around, and they actually emanate from the patient and go into what I'm going to call the clinician zone, because as people are breathing, this is coming out. What are your thoughts on, or how do you see the heightened awareness around aerosols and the effect that they can have because they can carry these viruses on the dental community, which generates amazing amounts of aerosols?
So I just want you to think back to a time that you may have gone to the dentist to get your teeth cleaned or to get a
20
filling
years
done.
ago?
Ha ha ha. Even to get your teeth cleaned? Naughty, naughty boy. So think about that time and think about what your face looked like when it was done. It was wet, there was splatter all over, yuck. So that is in the air, and that's what we're concerned with. One of the best ways to get rid of that is with high speed evacuation. So you have a dental assistant sitting there with a high speed evacuator. When that is turned off, where's it going to go? So a hygienist doesn't usually have an assistant, and the spatter is greater at that time. So
Hmm.
several years ago, 2, 3 years ago, we were introduced to Isolite, and it's a constant high-speed evacuator. I'm not going to advertise for you, Rolando, but it's made a difference in our clinics. I have to really say, our our staff can work alone because it's being evacuated. We've done it for a couple years, so that's not a concern anymore for us. The splatter is picked up constantly as long as that unit is on. So I think the key is high speed evacuation, but how can that be done constantly, have a dental assistant there, or have a tool that does it for you.
Awesome. Thank you for that. I appreciate it. It's funny, the biggest fear that people are having is, and we've heard this, patients are asymptomatic. So theoretically, consistent with the point you made about HIV, you have no idea whether a person is a vector and potentially infecting people or not. So you have to do that. How could you reassure, and you also mentioned fear, the clinicians who are I don't know how I feel, or even the patients who are feeling apprehensive about, well, if I'm going to go in there, am I going to get infected? What comments or what advice would you give?
So I can think back to the 80s. I have a cousin who practiced in very small town, and I was telling him at the time what we did for infection control in my private office with the universal precautions of today. His answer was to me, well, you have to because you're in San Francisco and there's a lot of AIDS there and people. And I said, but how about you? Your patients are more fearful to tell you they're sick. So somebody walks in and you ask them the wellness questions of today. Have you traveled? Do you have a fever? Do you have a cough? Maybe you take their temp, maybe you don't. How do you know they're telling you the truth? So you have to treat everyone as if they may have whatever the transmittable diseases of the time. In our time today, it's the COVID virus that we're scared of. But months from now, when hopefully we're all back to work, we still need to be aware that these are issues. We still need to be aware that the dentist will be wearing a mask, the dentist will be wearing a shield, the dentist will have eye protection. That will protect the dentist. But how do we protect the patient? Well, again, those same things work, but we clean the chairs in between. We use high-speed suction when we're working on the patient. We make sure that we have a clear field as we're seeing the patient. We wait in between before having a patient see the chair. And I think the key is constant high-speed evacuation.
Thank you. Thank you for that. So shifting gears slightly, the San Mateo Hospital is a clinic, and it's very different from the private practices, the groups, that type of stuff. How would you categorize, or what's the difference between that kind of clinic and then, or CHCs or community health centers and the private sector? How would you summarize that for folks?
So our clinic is the clinic of last resort for both medical and dental, which means that if you need help, you come to a San Mateo Medical Center, medical or dental clinic, and you will be taken care of. Your emergency will be taken care of.
Regardless.
So in our dental clinic, regardless, the amount that's paid depended on finances, but we turn no one away. For example, you come to a San Mateo Medical Center dental clinic, for which there are 5, one of which is mobile. You will be seen, your emergent care would be treated quickly that day or scheduled to be done. Now, let's say you need comprehensive general care, that's a different story. We are so backlogged, we have so many patients that want comprehensive care that we can't offer that, and that's embarrassing to say. We're good for emergency, but we have a 2,000 patient wait list. We're trying to get everybody in. This is for regular care. This is not emergent care. This is not, one of the things that I've been so lucky to have is a medical team that feels dental is important. Our orthopedists do not allow someone to have surgery without having a dental checkup. They don't start oncology or bisphosphonate or cardiology procedures without a dental clearance. OB patients are given priority. HIV patients are given priority. So these people come to the top of the list for comprehensive care, which is great. But the Joe, you and me, who just needs regular, preventive care, can't always get in. It's kind of like winning the lottery. We call your name, that your name has come up to come in, and people are, anxious to be in there. Yay. The good and the bad is that most of our patients, once they get in, continue with us. So we're allowing less new patients to come in because we're seeing recall patients. So we're working on hiring a hygienist. And we've hired one with the county. We're looking at hiring the second. When we hire the hygiene, that will keep the comprehensive going. And honestly, my little investment in the Isolite several years ago is allowing this to happen quicker, because it's very difficult to get dental assistance. And if suction is important because of keeping everybody clean, whether it's with the virus or just because you don't want splatter all over your face. It's your, it helps, and they can work alone.
Wow, thank you for that. I appreciate that. It's it's interesting. Place of last. I love the fact that you will treat anybody for emergency care, and it's very reassuring because there are a lot of people who are underserved, and I'm guessing that's a large population of folks that you treat there, and I think it's fantastic. I've been to your facility, and it's a beautiful, beautiful facility. So it's great to hear. How are you dealing with I guess there's a backlog now with COVID and everything shut down, only dealing with very, very, emergency. How is that? What are your thoughts around how you're going to have to handle that? Because now there's a backlog of a backlog.
Yeah. So one of the things that's been going on, our clinics are all open for emergent care. So if we had something scheduled that was an emergency, extractions or some of those things that we're talking about, those are still being done. What's not being done is the everyday filling or that sort of thing. But this is the same problem medical is going to have. You were not having a procedure done just for the fun of it. You were having it done because you need it. So if something has waited too long, be it medical or dental, it's going to become emergent. So we're looking at slow openings in all of dental, seeing less patients, bring them in, giving time in between. We have really good division between our operatories. So people are pretty much separate. They're not in the same area with each other.
Yeah.
One of the things they're also, go ahead. One of the things
please.
they're also talking on is having a patient come in one door and exit from a different door.
So it's in, through, out, ensure the integrity of that process.
So they don't cross each other.
Wow. From a team perspective, the how are you dealing with, and what's the kind of communication that you're providing to the providers and to the staff with regard to this whole issue? Because again, who knows what's going on? What are you telling them, and what are you doing to reassure them that things are happening?
Wear your PPE. I think that the general public had no idea what PPE was, personal protection equipment. Wear that. We've been harping on it for years, and now you're here, the whole world telling you to do that.
It's funny. It's something you've been talking about forever, and now all of a sudden it's like, so what's this PPE? You're like, oh, it's kind of like talking to your spouse. I've only told you that for the past 20 years, but now you're
really
hearing me?
Joke on that. Yes. And I've only been married for 45 years, and I still haven't gotten them fully trained.
Don't tell. I won't say anything. No one would know that. Of course not.
Keep it quiet.
So, shifting gears slightly, you're also an adjunct professor at UCSF and UOP. One of the things that's happening right now, and it is a big issue for the fourth years specifically, who are looking to graduate. There's this massive uncertainty because from a procedural perspective, they can't treat patients in clinic. So did you have any thoughts, or did you have any insight into what they can do, or what's going to happen there?
Yes and no. My position was more that the students came to the medical center and worked with us on our patients. When all this first happened, we did offer the students to come increase days. But I think at this point, they're trying to figure out what to do with them to get their didactics out of the way. I know that UOP, which I'm a little bit more familiar with than UCSF, is talking about extending they're on a 3-year system where they have a longer vacation in June. That vacation is going away, and they will work on it. They're talking right now of bringing the seniors in a week earlier than the rest, so they can get their didactics done. They're talking about ways to get them into the clinic. They're talking about whether working on a typodon is the same as working on a patient, which I've said no, but it's like they're trying to work on this sort of thing to find out what to do with them. I mean, I saw something that said we're all in the same boat. We're not all in the same boat. It's more like someone else said, we're all in the same storm. It depends what boat you're in. If you were going to graduate, if you were going to have some big thing happen to you during this time, it's not. And it's a little bit different. I mean, many dentists are not working. They're not eligible for any other income. And it worries me what will happen with the private dentist at the end of all this. So I know that the private dentists that I've talked to are really doing an upscale job and looking at what they did for infection control. Many are realizing that they did all the right things, and they're even trying to make that more.
Wow, wow, amazing. What advice would you then, what advice would you give to clinicians, especially at this time, who are feeling fear, who are kind of freaking out about the situation that we're in and whether or not this was the right profession to go into? Because all of a sudden, we've been hearing that, oh no, everyone always needs dentistry until now, when it's shut down. What advice from the wisdom that you have?
Wisdom.
And yeah, you've been through it, many of these. So
I can only draw that, and I don't want to keep mentioning when the AIDS epidemic hit. What were we going to do then? I mean, I think you need to I hate to just keep repeating this, but infection control is our main way of taking care of everything. But I would say that dentists are very used to doing that. They're very used to doing that. Keep doing what you were doing. I know that they're putting up shields on desks and stuff like that. That sometimes I wonder if it's necessary, but I think you give the perception of being better. Limit the amount of people in the waiting room. I know there's many people that are having patients, especially if they have kids. The child comes in and the parent waits in the waiting room. They're having them wait in cars, that sort of thing. I know that you're working with more assistants if you can get them and not seeing as many patients. But I don't want to seem like naive or a Pollyanna type. I think that you're safe. I really do. I think that we followed infection control. You don't go out there, how do I say this right? If you don't go out and step in front of a bus, but if you're around it, you step back and take the precautions that you need to take. I really think that you will find that dental offices are probably the safest place to have medical care because we've been doing it for so long.
I love that message, and I think that's important. So as a follow-on to that, for potential patients who will be viewing this or who are on right now, what message would you like to give them as this is viewed after this? What's the message you want to give to the patients out there who are, I'm in pain, but I don't know if I want to go in, or I'm not sure if this is an emergency or not, or even when things are turned back on. As you can see, some of the states are starting to turn on and people are going, I don't know if I want to go. What message would you want to give patients about that?
Be smart. If you have pain, it's not going to go away. Dental is different than any other type of pain or infection or disease that you have. If you have a headache, you can take a pill. You can't take a pill and get rid of the dental infection. It has to be treated. And the longer you wait, the worse it's going to be. So my advice to a patient would be to assess the situation, to call your dentist, see if they want to see you as an emergency. Trust what the dentist says as it being an emergency. When you go in, you will no doubt see that the dentist is wearing a mask, as they probably did before, is wearing gloves, as they probably did before, is wearing eye protection, as they probably did before, and possibly wearing a shield, which maybe they didn't wear that before, but they are now. When they're working on you, I just can't stress how important it is not to have splatter all over the place, but we've always watched that. We've always done high-speed suction. The low suction just helps you in that you don't get a lot of liquid in your mouth, but it's the high speed that takes care of the spray and the aerosol. I just think you just need to be aware of what's going on. Be honest. Be honest. Don't say, no, I'm totally fine. I'm no problem. I'm okay. Be honest, and because you'd want your dentist to be honest with you. Rolando and I met years ago when we put in the Isolite, and I was not his easy customer. I needed lots and lots of information. I was spending a lot of county grant money, and we had to prove that it was going to work. I think that in retrospect, it was a very smart thing for me to do because of the high speed evacuation. That is being talked about all over as the best way to get rid of aerosol splatter and that sort of thing. So, not to want to give him a plug, but our isolites, we have isolites on all 20 of our chairs, and my staff has loved it. My assistants have loved it because I don't have to stand by the dentist in here. Can you get this? Can you get this? Can you get this? And patients like it. And in this area that we're in right now, the importance of suction and we're putting all this protection not to get the splatter on us or the patient. Our clinic has also put safety goggles on patients, which is not always done and not necessarily required, so they don't get spatter in their eyes. The importance of the suction, I can't stress how important that is today, even more than I thought it was before.
Thank you for that. Really appreciate that. So you're clairvoyant. You knew this was going to happen. That's why you decided.
I guess I did.
So as a way to kind of encapsulate everything we've talked about, and as a way to kind of to summarize this as a kind of closing statement for our session, what is it that you'd like to get across to listeners, to people who are going to be seeing this over the next forever, basically? What is it that you'd like to, how would you like to kind of close that down and summarize what we've been talking about?
There's two populations that I say that can be interested in this. One are the providers, the dentists, the assistants, the hygienists. Don't be afraid. Work smart. Protect yourself. Protect your patients. And you do that with proper PPE for yourself and equipment for the patient. For the patient, again, be smart. If you have a problem, it's not going to just go away. Take care of yourself. Treat the issues that you have. Go to a dentist that you can trust and you see that the infection control is being done. Be honest with each other. If you have the disease, tell the provider, tell the patient, close your clinic if you have to. I mean, I know myself, it didn't matter how sick I was, I wanted to work, wear this mask, but you can't always do that. So just be honest with yourselves. And aerosol spray, however it gets on you, make sure it's protected and take precautions for it not to be on you.
Really, very much appreciate that. It's funny, there's a directness and just a calmness. Don't freak out. The sentiment that I'm hearing very clearly in everything you're saying is that, hey, you've been educated. This is what we do. This is what you've been doing. Don't forget that. Remember, but also don't be crazy. Don't be stupid. Don't miss things. And that's fantastic. If people had questions or wanted to reach out to you, or if people wanted to send you a message or just chat, would you be open to having a discussion with them?
Yeah, and I have my email, and I'm hoping you can see this. Okay.
All right, here, hold it. Okay, very good. So
got it.
Yes, thank you. So
thank you.
It's okay for people to reach out to you, send you messages and all that type of stuff?
It's fine. I don't claim to know more than the next person. I've just been through this a lot. And I just think that calmness and watching what you're doing, check what you've done before if you're a dentist, and just don't be so worried that you have to change everything, because chances are you don't have to. But just, think about yourself and your patients and the importance of being safe.
That is so awesome. So I have to ask, okay? You don't seem worried about this. There's a reassurance that is. Where's that coming from?
I think it comes from the years of experience. I mean, I was very worried during the AIDS epidemic. Of course, that was a long time ago, and I was much younger. And I remember getting a needle stick during that time and I think this is probably what made me calmer. I've gotten 2 needle sticks in my 45 years of dental. When I got the first one, I was working at San Mateo Medical Center. I hit the jackpot. He had AIDS, he had syphilis, he had hepatitis. I went through all the precautions. I made everybody know that I came at the medical center. I was lucky. I was fine. I think that transmission is difficult if you're following the right precautions. You're not going to go sit on top of the patient and breathe in his saliva because he's got COVID. You're going to get sick. So let's be realistic. Let's wear the gear that you're supposed to wear. Let's put the things that we can do for the patient to eliminate the amount of spatter, to eliminate you can't eliminate it totally, to reduce the amount of splatter, to reduce the aerosol. Like I said, the PPE for the provider to wear, protection for the patients, suction, whether it's with a dental assistant, with high speed, or with an Isolite if you want to make your life easy and not have an assistant right by you. Whichever way you're going to do it, these are important. And I also would like to add, I know that it's not necessarily done all the time, but eye protection for the patient is important too. So just think about it. And if there's a patient sitting in the chair, in every clinic I've worked in, the county clinics or my personal office, I always felt that I didn't mind if I was that patient. I felt it was clean. I felt it was protected. And if you can't say that you feel that way, then you should not be practicing.
Thank you. Thank you for that. I have a theory. I believe that the AIDS, hepatitis, syphilis, all of those diseases that were in that pinprick came into you, and your body said, no, grabbed it, threw it out. That's what
You're too bossy. You're too bossy. We better not take this.
It was like, you're not doing, not here. Get out.
To give a plug for our organization too, the San Mateo Medical Center takes care of everybody regardless of their ability to pay. We have San Mateo County Health Foundation, which has been wonderful in obtaining PPE for the group and all that kind of stuff. It's supported us over the years. What I've noticed in difference from going from a private practice to the community practice is that we have infection control people there that keep us up to date on stuff. That didn't mean that I didn't have to. I mean, our infection control department knows nothing about dental of what I've shown them. And I've listened, we've worked together. So that's the importance to me, is work together with the resources that you have.
Thank you. Thank you so much. That is absolutely wonderful. Hey, everyone, those of you, this is Dr. Anne-Marie Silvestri. I love the calmness and the focus. She clearly knows what she's talking about, and I very much appreciate that. If you like the content, or if you have any questions, first of all, for Dr. Anne-Marie, please feel free to reach out to her. She gave her email out there. She's been a fantastic resource for us, and I especially like how, no bones about it. And that's so cool. If you like this content, please share it. If you have any additional information, or if there are topics that you'd like us to talk to with our clinicians and our guests, please let us know. Thank you, Dr. Anne-Marie. Thank you so much.
You're welcome. Thank you for inviting me.
Oh, not at all. And please, when this is all over and you're still retired, would you be open to coming back? I'd love to hear how things are going post all of this. Would you be open to doing that with us?
I will. Retirement's been odd because it was March 27th, the day this really hit big. So
awesome.
Thank you.
Well, have a great rest of your week. Have a great weekend. Please be safe, and thank you so much for joining us. Really appreciate it.
Thank you.